afternoon and welcome to our second presentation by Mytle Health. This afternoon we do have our speaker, Dr. Gordon Attoh. Dr. Attoh is an obstetrician gynecologist of more than 20 years of experience. He was the medical director for the Pentecost Hospital in Medina and currently also the medical director for the Chosen Hospital and Fertility Clinic. The Chosen Hospital and Fertility Clinic is a fertility clinic that is helping Ghanaians and people all over the world to achieve their dream of having children. And in a year, they are able to, they have about more than 300 success, are able to give expecting women what they have been desiring all their life. So in our presence today is Dr. Attoh. Dr. Attoh is going to talk to us about understanding perimenopausal changes and the risk of gynecological cancers. So please, let's welcome Dr. Attoh. Dr. Attoh, the floor is yours now. Thank you.
Thank you very much, Dr. Bedu, and a very good evening or good afternoon to you wherever you find yourself in the world. First of all, let me say thank you to the organizers for inviting me and giving me this opportunity to share a few thoughts with you. I have a very short time and the scope of my presentation is so wide, so I'm going to jump a few of the slides and I'm going to make it as simple as possible for all of us to understand. Now, well, by way of introduction, we know every human being goes through a transition. You are born as a baby, you become a child, and then you become a young adult, and then you become an old person. Each of these stages presents a whole challenges to physically and sometimes health-wise to everyone. And in this context, we are talking about women. And we are going to identify one of the stages, which is towards the end of their reproductive life. Some of the changes that take place in their bodies, in their health, that pose a challenge to them, that affects their everyday function, and what they can do in this period. And then around that period, a lot of the gynecological cancers also show up. And what are the things you should be looking out for so that you can detect those cancers early? Once it is early detected, management is better and the prognosis is better. People are able to survive the cancers. So we know that about 60 or 6 to 8 out of 10 women will experience very bothersome symptoms, which may take them to the doctors when they are transitioning into menopause. Sometimes they don't understand. It appears to them as if their world is changing. It affects their psychology. It affects their physical health. Sometimes they go into extremes and people label them. And when they come to the doctors, sometimes they expect that the doctors will have the final antidote. But unfortunately, most of the time, we are not able to completely solve their problems because, this is natural. And so they become disappointed. And at this point, when they become disappointed in the traditional medicine, then they resort to other forms of medical care, including herbal medicines, and then the so-called pastors also chance upon their ignorance and suggest a whole lot of things to them. And you find some of these women in prayer camps stop their job and go into prayer camps because they are made to believe that a spirit is what is responsible for somebody who doesn't like them is the one responsible. But once they understand, they will know that it is a phase and it will pass, and that phase will not last forever. So menopause, we have almost 2 or 3. We have 2 stages, one which we call the perimenopausal stage, that is the years leading up to menopause. Change in your menstrual cycle. Sometimes this change may make you, your cycles become longer than usual. You may be a 28 cycled person. In some women too, it becomes shorter, and others also skip their menses for a period of time before it flows. Now, let's look at the definition for menopause. You see, we say a woman has gone into menopause. The whole year you haven't seen your period, then we say you've gone into menopause. And it marks the end of your reproductive cycle as a woman. But with modern technology, even when you stop menstruating for a whole year and over, we can still make you have babies. We can still let you have symptoms and you flow, and then you can have babies. The average age that women go into menopause worldwide is 51 years. But in Ghana, Dr. Kume and his colleagues found out that the age at which most women go into menopause in Ghana is about 48 years. So that is a little below the average age worldwide. Just a brief epidemiology of menopause. In 2021, the WHO found out that we have about 1 billion women who are in their menopause state globally. And it is estimated that about 1.6 or more than 1.5 billion women will be in menopause by age 2050. And the menopause transition consists of perimenopause, as I've said earlier, and the first 12 months after the final menstruation. There are various symptoms that women have when they go into menopause. Statistics show that 20% of them would experience hot flashes in their late 50s, some 10% into their late 60s, and then 5% into their late 70s. So you see that sometimes women have a very long time experiencing symptoms. That's a very few percentage of women who have those symptoms. What are the risk factors for early menopause? Why would some people have early menopause? And why will others go as late as 60 years before? And it's all genetic factors which runs through the family. So if a woman's mother had menopause early, it's likely that some of her children will also follow suit. Some are as a result of some diseases like autoimmune disease of the thyroid and some chromosomal abnormalities. Sometimes medical treatments may put somebody at risk to have early menopause. In some cases, some have, some chemotherapy because of a cancerous situation, and that puts them into early menopause. Sometimes infections also contribute, and then unhealthy lifestyle. So who is more likely to undergo an early menopause? Now, you can predict this thing in their childhood, in childhood stage, and then you can also look at adults and predict who will go into early menopause. What are the things? So it is found out that women who grew up in a working class family usually have early menopause, high risk of early menopause 2 times. And then if you were not breastfed as a child, or you were breastfed for less than a month, it is also likely you will have early menopause. There's a strong correlation. Processes can increase your risk of having early menopause, such as people with polycystic ovarian syndromes and some other diseases may have a higher risk of early menopause, about 68% chance of early menopause. On the contrary, women that exercise more, about 1 or more days in a week, they have a lower risk of entering menopause. They go into menopause a little late, about 25% lower chances of early menopause. And then some economic reasons. Women that are not employed in their late 30s and their early 40s, statistics show that they have about 43% risk of entering into early menopause. Now, let's quickly look at some of the signs and symptoms of menopause. It's a very tall list. We can divide them into physical symptoms, psychological symptoms, symptoms that affect the intestinal tract, digestive system, the vasomotor systems, oral systems, and then the nervous system. So it's a very tall list. You are very familiar with some of them. Physically, some may lose weight, some may gain weight, some may lose their hair. There's vaginal dryness. They have issues with sleeping, dizziness. Sometimes they have urinary problems like incontinence and so on and so forth, weak bones, osteoporosis. The mood swings that we are very familiar with. In some people, it can be that severe. In such cases, it affects their output at work, in the house, and everywhere they go, even in the church. The mood swings can occur there, and people will start labeling them and tagging them. Others call them witches because they say things and they do weird things. Difficulty in concentration. With their digestive problems, they can have bloating, and some of them have issues with digestion. Night sweats, hot flashes, sometimes gum problems, and some may experience electric shock sensations in their extremities. These are some of the signs and symptoms of menopause. Now, in the 60s, because of some of these problems, there was a breakthrough with the use of hormone replacement therapy. We started with estrogen-only medications. This was widely accepted, but they found out that there was a problem with just estrogen alone or estrogen-only hormone therapy. So there was an addition of progesterones to get rid of some of these problems, such as increased risk of endometrial cancer and all that. So once they added that in the 1975, a lot more people found it more comfortable to use it. Those that used it in the 1980s, research shows that they had some benefits from the use of these combined hormone replacement therapies, such as lower risk of congestive heart diseases. They had lower risk of osteoporosis, that is weak bones. It helped them with their retention and memory. And then a lot of people jumped into the bandwagon, and we tend to see more use of hormone replacement therapy. But today, few women are using hormone replacement therapy. We are trying to avoid some of the side effects and the risks it poses to women. So today, people are using natural means more than using hormone replacement therapies. Hormonal therapy for women is not for everyone. There are some people who cannot use hormone replacement therapies, and some of the people who cannot do that are people suffering from breast cancer endometrial cancer, some of them that have unexplained vaginal bleeding, hypertension. If you have a high blood pressure, it is not recommended for you. Peripheral artery diseases, those who have had DVT in the past or have clotting disorders, and people with liver problems too, we do not recommend that they use hormone replacement therapy. So, what do they often use now? A lot of people take to exercises. A lot of people engage psychologists to help them with their psychological issues. Some have what do you call peer people that they share ideas and they share information, and then somebody's information helps the other to cope. Sometimes your partner plays a very important role by understanding the problems you are going through and then assisting you, providing you with the so that they go through. Thankfully, this is not a permanent problem. It fades away with time. About 90% of people may get out of it within 10 years. Some people within 1 year, they get out of it. So menopause and perimenopausal issues are very common. And most women should expect that there will be changes in their system, physically, psychologically, sometimes in their GIT systems and all. So they understand the situation. Once you understand it and you have the requisite information, you are able to cope with the situation better than those who don't have any clue at all, who may attribute it to spiritual problems and all that. And some people can capitalize on their ignorance and then prescribe all sorts of things for them. We've seen people who have been told to drink urine of old ladies. I saw one woman who was advised that when she drank urine from an old lady, it will help her. And this was a big issue. So I think information must go out there to help the women. Now, quickly, let's look at some of the gynecological cancers. I have about 5 on my list. The first one, which is fibroids, is not really a cancer. This is not a cancerous problem, but it's so common that I think I need to say a word or two about it so that we understand. Because about 70 to 80% of women will have fibroids in their lifetime, one time or the other in their lifetime. Fibroid is a growth that occurs within the reproductive age of the woman. Once you have the uterus and your ovaries are active, you are more likely to have some of these abnormal growths on your uterus. Excuse me. So they are non-cancerous, as I said, and about 68.6% of women in their reproductive age will have a cancer. So if you go out 3 women in their reproductive age, chances are that 2 out of the 3 may have uterine fibroids, and they may not even know about it. The problem is that, what I mean is that fibroids usually do not pose problems. And so most people don't visit the hospital. It is only when they begin to pose challenges that people realize they have fibroids and then they visit the hospital. So who is at risk of developing uterine fibroids? So generally, every woman in the reproductive age group with their uterus intact and ovaries intact have a chance of developing uterine fibroids. But those at high risk are those that are overweight. So it is important to check your weight as a woman, because the more weight you gain, the more likely you may develop uterine fibroids. If you're a Black woman, you also have a higher chance of developing uterine fibroids. People on birth control pills, people whose parents or first-degree relatives have uterine fibroids, you are also at a higher risk of developing uterine fibroids. It is known that diet plays a role. Diet low in fruits and vegetables play a role, but I've seen quite a few vegetarians who have developed fibroids. So I don't think this is entirely true, but it is reduced in people who take more vegetables and fruits. And then girls who start their menses very early are also at a higher risk of developing fibroids. And women that indulge in alcohol, take very large amounts of alcohol, also stand a higher risk of developing uterine fibroids. Like I said earlier, most fibroids do not show any symptoms at all. So the lady maybe sees a doctor and then they do an ultrasound and then they found out that she has fibroids before they are even aware that they have it. But a few times they may have some symptoms that will send them to the doctor. And such symptoms include heavy menstrual flow. Women that have heavy menstrual flow, just a moment. So women that have heavy menstrual flow may have a fibroid, sometimes infertility. They come and tell you they are not unable to have children. And then as part of the investigations, you find out that they have some fibroid somewhere that is preventing them from getting pregnant. Some also come with pressure effects. They come and tell you that they feel bloated in their abdomen and they have heaviness in their pelvis. And those are some of the things they present with. Others also come with severe menstrual pain. Some also come with bleeding after sex or during sex. They see traces of blood and they get worried. Others also come with urinary symptoms. Sometimes they are unable to pass urine at all. Sometimes too, they have frequency. They wake up several times in the night to wee-wee, and then they go to the loo. It's very little. So what are the problems of fibroids? Most of the time, they present with infertility some of the time. Some also present with menstrual issues, pelvic pain, and then some are unable to get pregnant. And then when they get pregnant, they have problems. They have severe pain, lower abdominal pain in the course of the pregnancy. Some of them too, it leads to early delivery. They go into labor prematurely. And some of them also have labor complications such that they may not be able to deliver vaginally and they may be delivered through cesarean section, and then some miscarry. My slides seem to be frozen. Okay. So how do we manage uterine fibroids? Basically, we don't do anything about fibroids until they become a problem. And there are two basic ways we manage them. Medical management. The medical management is for people who may have less symptoms or symptoms such as pain. So we give them pain relief. Sometimes we give them medication also to block the amount of estrogen they produce. And then some of them too, we give them combined contraceptives to make them stop flowing at all. So these medical management usually are for people who have less symptoms or people who do not have interest in having babies. But for those who have interest in having children and they have severe symptoms, we may need to operate on them to take out the fibroids. And then the surgery is mainly an open surgery or a keyhole surgery like laparoscopy, hysteroscopy, and resection. All those things can be done. In some cases, we also try to block the blood vessels that supply the uterus. In so doing, you reduce the amount of blood flow to the uterus, and the fibroids shrink, and the symptoms also abate. Sometimes we also try to scrape off the endometrial lining, which leads to the shedding of more blood. So once you do the endometrial ablation, they bleed less and they have no problems at all. This slide has gone very fast. The second cancer we quickly want to see or look at is breast cancer, which is very common in women. It's so common that it's the leading cancer in women, and it's more common in the Caucasians than in Africans. But when it happens in Africans, for some reason, they are very aggressive and management is difficult. Most likely because most women present very late. And then they may have gone through other forms of treatment before they present. And at the time they present, it has spread beyond the breast, and then it becomes very difficult to manage. And at that time, you have very little to do, only palliative management for the breast cancer. So in 2022, WHO said we estimated 2.3 million women who were diagnosed with breast cancer, and then about 670,000 deaths globally. And every country in the world has recorded breast cancer, including Ghana. Now, who is at a higher risk of developing breast cancer? Or what do you do? What do you see in people that have breast cancer? We can see them in two phases, modifiable and non-modifiable risks. And the modifiable ones are the ones that you can do something about. The non-modifiable ones are those ones that there is nothing you can do about. The older the woman, the higher the risk of she getting breast cancer. Breast cancer also is in both males and females, but it's more common in females. So gender also plays a role. Family history. If anybody in your family, first degree relative, your mother, any of your sisters have developed breast cancer, you stand a higher risk of developing breast cancer. We've also identified some genes that lead the mutation in breast cancer. So if you have those genes, then you should know that you have a higher risk of developing breast cancer. And then somebody who has had breast cancer before is also likely to have breast cancer in the other breast or in the same breast as well. So these are the non-modifiable ones. The modifiable ones are people who take alcohol, people who smoke, the obese, those who use combined contraceptive pills and hormone replacement therapies. They also give you a higher risk of breast cancer. Now, how do you know you have breast cancer? Let's note that early detection is the key. If you are able to detect any cancer very early, chances of you having a cure from the cancer is very high. But when it spreads, it may not be curable. We may just have to manage it, and eventually it may kill you. So if you see any change in your nipple, in your breast as a woman, whether at the nipple or the skin around the breast or in your armpit, it is important for you to report to a doctor for assessment. It may be the beginning of breast cancer. Sometimes you may even see a lump, actually, or feel a lump in your breast. You don't have to take it lightly. And when you have skin irritation too, may not be just anything you can just sweep under the carpet. Sometimes it can be breast cancer that has just begun. So the word here is that any change you notice in your breast, please try to seek medical care and let them find out if it's a cancer or not. So how do you treat breast cancers? Mainly depending on the stage at which the cancers are detected. Then you have treatment modalities, which may include surgery or a combination of surgery and chemotherapy and radiotherapy and hormonal therapy, depending on the type of breast cancer and the grade. So these are things that you may. So every woman must learn to self-examine their breast, and then when they notice any change, they report. Now, quickly, let's look at endometrial cancers. The endometrium is the lining of the womb. That is what you shed every time a woman is having her menstruation. These endometrial cells can also develop cancer and cause problems. Like I said, when it is detected early, treatment cure is possible. What are some of the signs and symptoms of endometrial cancer? Most of the time, it is abnormal vaginal bleeding. Sometimes people have pain in their lower abdomen. Sometimes post-sex, they see blood, and then they have pain as well. And then postmenopausally, if anyone sees any blood after menopause, please go and check, because it may be either an endometrial cancer, or it may be a cervical cancer, or any of the gynecological cancers. So the risk factors for endometrial cancer, there's a mnemonic for that: old aunts, people who are obese, increase in weight, you stand a higher risk of developing endometrial cancer. Those who go into menopause late also have a higher risk. Diabetes is a risk. If you have cancer of the ovary and the breast, you also stand a higher chance of developing ovarian cancer. Unopposed estrogen. When we say unopposed estrogen, mainly people that start menstruation very early. They also do not give birth. People who have not given birth before, they also stand the risk of having endometrial cancer. And then one medication, tamoxifen, that is mostly used for breast cancer patients. And in some cases, people use it for induction of ovulation. Prolonged use of this medication can predispose you to having a higher risk of endometrial cancer. So the common symptoms when you start spotting or vaginal bleeding between periods, you need to check. Now, this is not only common to endometrial cancers. You may find out that cervical cancer also share the same symptoms. Changes in your periods. Sometimes it becomes heavy. You need to check for it. When a woman is in menopause and start bleeding vaginally, again, you need to check for it. Lower abdominal pain or pelvic pain. Discharges, very offensive vaginal discharges. It could also be a sign or symptom of endometrial cancer. People who have pain during sex may also be a sign. There are other conditions such as endometriosis, adenomyosis, even uterine fibroids can also give you pain after sexual intercourse. And when you start losing weight very fast, unexpectedly, you need to check what is the problem. And then when you feel a mass in your pelvic region, may be a sign of endometrial cancer. How do we manage them? When it is detected early, total hysterectomy may suffice. And sometimes you may have to remove the ovaries of the person as well, because some of the ovaries, estrogen may also predispose you to having endometrial cancer. So you may have your ovaries removed as well. Sometimes radiation and chemotherapy can be added to the treatment. And depending on the grade, you can have complete cure, or you may have palliative to extend your life for a while, so you can prepare your house before it finally takes you away. Now, cervical cancer, one of the big one in the room. And I believe that we've heard so much about it. The cervix is the entrance to the womb. Sometimes when women douche, they are able to feel the cervix. That lump or knot deep in the vagina they feel is the cervix. And this can also develop cancer. Now, cervical cancer is the commonest cancer in Black women. And it's a problem. Thankfully, now there's a screening process that you can screen for early detection. And then there is also a vaccination that can be used to prevent it. So when the cells of the cervix begin to grow abnormally, it's what leads to cervical cancer. Sometimes people may feel mass in the vagina as well. So according to WHO, globally, we have about 660,000 new cases every year and 350,000 deaths. 94% of the 350,000 deaths caused by cervical cancer occurred in low and middle income countries. So you see, the poorer you are, the more likely the cancer may kill you. Women living with HIV also have very high risk of developing cervical cancer because of opportunistic infection. Cervical cancer disproportionately affects younger women. And as a result, 20% of children who lose their mother to cancer do so due to cervical cancer. So it's a big issue. What are the risk factors? It's not so different from endometrial cancer. Women who are on oral contraceptive pills for long, people who have early marriages because they are exposed to early sex, people with multiple sexual partners, or your partner has multiple sexual partners. So you may be a faithful woman, but if your husband or your partner has multiple sexual partners, you stand a higher risk of developing cervical cancer. Those who start sex very early on in life also have a higher risk of cervical cancer. And then people also who practice poor genital hygiene, people who smoke, people who give birth more frequently, and then people with weak immune system have a higher risk of developing cervical cancer. Now, the devil in the room is a virus, which is a human papilloma virus, which is mostly the causative agent, and that increases the risk of you developing cervical cancer. So human papilloma virus is a common sexually transmitted infection which can affect the skin, the genital area, and the throat for those who practice oral sex as well. In addition, all sexually active people will be infected at some point in their lives, but usually without symptoms. In most cases, the immune system clears the human papilloma virus from the body. However, when you have persistent infection with high risk HPV, you can develop cervical cancer. So human papilloma virus is the main thing. Those who smoke heavily, weak immune system, I think I've gone over this already. Now, there are different stages of the disease, and that will determine what can be done for you. So the mantra is that early detection saves life. So women should submit themselves to screening process for cervical cancer. Fortunately, pap smear is the commonest screening process. When we find abnormal cells, some other tests can be done, and then we will detect if you have cervical cancer or not. So what are signs and symptoms of cervical cancer? Like we said, it's not too different from endometrial carcinoma, vaginal bleeding after periods or after menopause, bleeding which is longer than usual, Sometimes after intercourse, you have bleeding, pain during sexual intercourse, persistent pelvic pain, sometimes pain during urination, and people who visit the urine frequently, vaginal discharges and weight loss can be signs and symptoms of cervical cancer. I think the stage and the treatment is something that maybe I may skip. How can we prevent cervical cancer? There's a vaccination for children. They can be vaccinated between the ages of 9 to 14. This is for both males and females. So males may not have a cervix, but if they are vaccinated against cervical, the human papilloma virus, they don't transmit them to their sexual partners. You should also be screening for the cervical, the pap smear, and people with HIV stand a very high risk of developing cervical cancer. So they must even submit themselves for more screening than the other persons. And at any age, at any age with symptoms or concerns, early detection followed by prompt quality treatment can cure cervical cancer. So it's possible for cure. So in conclusion, every woman at a point in time, especially in their late 30s and 40s, may develop symptoms we call perimenopausal symptoms. There is a need to see a physician to discuss your symptoms and receive appropriate counseling and management. When you understand what is going on, you cope with it better. And then we also want to say that in that age bracket, gynecological cancers are real, and some of them can be prevented. So early detection is prompt. When we find it, we can cure it and you'll be free. Thank you very much. If you have any questions for us, we'll be glad to take them. I hope I have done it within time.
Yes.
Dr.
Thank
Bailey,
you.
is Dr.
Yeah.
Bailey still on?
Yeah, that's what I was looking for you to do. But thank you very much, Dr. Attoh. I
Thank you.
think
Sorry,
Dr.
I'm
Bailey
here.
is coming. Okay.
I'm here. Thank you very much, Dr. Attoh. This is an excellent presentation. I think it's already 4:54 p.m. Normally, we want to take about an hour or less of your time. It's almost an hour. We did have some interruptions, unfortunately. This is our first time for those of you who join us for our health talks. We've never experienced something like this before. But unfortunately, these things happen, and we'll hope that next time we'll put our security team in place to avoid such disruptions. We'll open the floor for the next 5 to 10 minutes for any question. If you have a question, please raise your hand, or you can as well type it in the chat, and we'll have Dr. Attoh answer it.
No question?
Well, I guess Dr.
Okay.
Attoh did a very good job. We have
Yeah.
a lot of ladies here.
Yeah. Doc, some people couldn't join. They watched it on Facebook Live, so I
Okay.
have a
There is a
few
question,
questions.
yes.
Okay, so if you
Okay.
can do that,
So
then we'll
to Dr. Attoh, how do you distinguish between menopausal issues and other health issues? That's from Akosha Dimfua.
Well, thank you very much. It's sometimes a bit difficult to differentiate between some psychological issues associated to perimenopausal or menopausal periods, and then actual psychological problems that may not be emanating from them. But the specialists, especially when it occurs around the perimenopausal time or the menopausal time, you may attribute it to the period. But the good thing about psychological problems or all the other symptoms, physical symptoms that are associated with the menopausal period is that they are temporal. Most of them are temporal. So after a while, they may go away, except for a few like osteoporosis that may pose you to having bone problems because you have weak bones as a result of demineralization of your bones. But most of them are temporal and may go with time. A few may need actual medical interventions. It's a bit difficult to distinguish between them, but once the symptoms start occurring around the perimenopausal symptoms, those are the first things we attribute them to. And later on, if they don't disappear, a more comprehensive examination may have to be done to ascertain the cause of the problem. So I admit, sometimes it can be very difficult to distinguish between just the perimenopausal symptoms and that of actual health conditions, especially when they happen around the same time.
There's another question from
another question.
Tabitha.
Yes, I'm listening.
Please distinguish between diabetic night urination, that's polyuria at night from diabetes, and that of cervical issues, I believe. That's the question.
Okay. Diabetes does not only come with urinary problems. You know, first of all, we have polyuria, which is large volumes of urine that the person produces. And then polydipsia, the people usually take in large volumes of water. Even though they drink a lot of water, they still feel thirsty. And then they begin to have loss of weight. But in the symptoms associated with pelvic and endometrial problems, normally you don't have polydipsia, which is drinking enough large volumes of water associated. A few may be associated with weight loss, like those, the cancers may also give you weight loss. But the catch is that in diabetes, you produce more volumes of urine, you drink more volumes of urine. It is not necessarily frequency, but the volume. And then you also notice that the urine you produce, sometimes if you wee outside, you find ants and other creatures around it, that may suggest to you that it may be diabetes. And those of you who can taste your urine, sometimes some of the diabetic urine, it may be a bit sugary. So that can also give you a clue, the difference between that and then that of the frequency associated with endometrial and gynecological problems.
Hello, Dr. Attoh. Some people couldn't join. They were watching on Facebook Live. A few have sent in some questions. So one question says that if I don't have a cervix, do I have to worry about HPV and cervical cancer?
Well, once you don't have a cervix, you don't have to worry about cervical cancer unless the cervix was removed after you have developed cervical cancer and some have traveled beyond the cervix. Otherwise, it's not a problem. Once the cervix is not there, you are not at risk of developing cervical cancer.
Okay. Then the next question is, the person said that you made mention that these days the symptoms, women were not using HRT late in more recent times. So her question was that if she is on HRT, how long should she be on it? Because they said HRT sometimes helps with the brain fog and all the other symptoms that come with it.
Well, I think that the doctor must determine how long the person should be on the HRT. The shorter you are on it, the better, because of the symptoms and side effects you may get from prolonged use of the HRT. However, that must be answered. That question must be answered by your doctor. It depends on the kind of symptoms the person presented with and the gravity of those symptoms for which she was put on HRT. Once the symptoms get better and the person is able to manage without the HRT, the doctor will, I'm sure, will draw the HRT and see if she could cope without the HRT. So it varies from one person to the other. But the advice is that the shorter, the better.
Any more questions?
There's one that says, are there supplements that are beneficial for menopause?
Yes, I've seen quite a number of supplements on the market, but its efficacy is not well documented. A few people have some benefits from them, and it abates some of their symptoms. But I haven't seen one of them that completely takes away the problem of the perimenopausal syndrome. I've seen quite a number of supplements on the market. So there are, but they are not so effective, if I should say that way. They are not so effective. Any more questions, please?
Okay, there's something in the chat. Says, please, what are the side effects of taking tamoxifen?
Well, tamoxifen, you know, for breast cancers, people with breast cancers, especially hormone-sensitive ones, when they are on breast cancer, tamoxifen, sometimes nausea, vomiting is one of the problems. Some also suffer from it, leads to an increased risk of endometrial carcinoma. Tamoxifen generally is very safe, but prolonged use and its association with endometrial cancers is the main problem. But most women on tamoxifen tolerate it very well.
Thank you, Dr. Attoh. It's 5:05. Once again, thank you for a very thorough and revealing presentation. I hope everyone here learned something new that they're going to use in their life. This presentation, as I said earlier on, was brought to you by Mytle Health. And before we all go, I would like Josephine, our administrator, to give you all a brief overview of what Mytle Health is or what Mytle Health does. And after that, we will call it an evening and night in Ghana. Thank you, Josephine.
Okay, thank you, Doc. We'll leave the screen as it is. I'll just speak extempore because there's no time. So I'll just use 2 to 3 minutes to explain what Mytle Health is. The idea of Mytle Health came about because of ease access to technology. Now everybody does a lot of stuff with their phone. So it's the same idea. where you can use your phone to make an appointment, to check your medical records, etc. We are in that era now. So for Mytle Health, what we do is that we are bridging the gap for Ghanaians in the diaspora. So it's not only in the US, it's the UK, Germany, everywhere, who find challenging issues with regards to healthcare for their relatives and loved ones in Ghana. Mostly the group tend to be their parents back home, but they have siblings, they have other relatives. So what we do is we try and bridge that gap for them. So we have our website, www.mytlehealth.com. You can go there and look at our packages and then select a package for your loved one in Ghana. You do the payment in the diaspora. So we call you the sponsor. You can pay anywhere in the world. We accept all forms of payment. And then within 24 to 72 hours, someone in Ghana will contact your relative or loved ones. That patient either has the option to go to a lab. We work with MDS Lancet Quest. We work with Spectra in Kumasi. We have diagnosis centers that we've partnered with. And then we have outpatient clinics, Sanford World Clinics. They have 3 clinics in Ghana that we have also partnered with. So the patient has the option to go to a facility or to go to the lab. And then we have a physician network provider system all over the country. The physician networks, they will come home after you've done your labs. They will come home with the lab results and do the physical examination at home. The only thing the package does not cover is your medication. Now, when they come home, or even they go to the facility, the patient who is your relative, because of HIPAA laws, will agree that we share the results with you, the sponsor, abroad. So once that is done, the report gets here. Our doctors in the US review it and examine the plan of care, and they are free to speak with you, the sponsor, about the plan of care for your mother, father, relative, loved one in Ghana. So in simple terms, that's Mytle Health for you. And then we have different packages. Some are single visits, some are multiple visits. All of that is on our website, www.mytlehealth.com. If somebody can put in the group chat for me. And then we have a WhatsApp number that you can always call or leave a message. And the WhatsApp number is 469-722-2546 and 469-722-2519. So I think in a nutshell, since we are almost 5:10, I'll end it here. Our website, I'll put it in the group chat, is www.mytlehealth.com. Please do pay a visit and let's help you find peace of mind by helping your loved ones in Ghana so that you are not being called upon every now and then that they are sick and we don't know what is going on. Our doctors here can help you navigate that. Thank you.